if you want to sit up front.
Yeah.
I'm not going to force audience participation, so if you're up front. I'll talk the entire time if I need to, but audience participation definitely helps.
Oh, thank you, Laurel.
Without disturbing me. Where can I go past?
Right there.
Go past here. What was the outlet?
Yeah.
I made that up.
Oh.
I'll take a sure now.
You seem to have been a little bit further when most I
Yeah.
go past this.
Yeah, I just don't want to feel so
Said always pushing boundaries.
Should be the name of my
So a
business,
little
pushing
bit
down.
too.
Yeah.
About our backs.
Back up.
Are we good, Mo? Is that live and?
Oh, it is. Yep, we're live. Don't make me talk to you.
Okay.
We live.
All right.
Oh, you're checking it.
Distressing. I was just curious, just to show of hands, who works out here?
Disrupted is live. She
She
does
too.
too. She
Oh,
does.
sorry.
I work out here.
All right, great. So I did try to design this talk with that in mind, but we're going to keep this very basic so that you all feel like you take away something. To get started, I do just want to say a big thank you to Liza and the team here at Duddy Performance. This is something Liza and I have talked about for a while, so it's awesome that it's happening, and I hope that it continues to happen. And so you guys, spread the word about Duddy and about In Condition. We would appreciate that. I just want to.
If there's any other topics, right? If you guys think of things.
At the end, yeah. If we want to share anything else, I'd be happy to talk
Well,
about.
I mean, for future
Yeah.
talks.
Yeah, definitely. Happy to come back for sure. A little bit about me. My name is Jamie Grill. This is my business, Mint Condition Physical Therapy. I've been a physical therapist for over 10 years now, and I started my career, and I'm still at Spalding Rehab in Framingham. And probably 2+ years ago, I started to think about the idea of starting my own business, and I had my second child, Mackenzie, in January. And I said, okay, this is what I need. I'm gonna go back to work part-time. I'm gonna get this off the ground. So officially started in August and have been having an absolute blast seeing people privately. I really love working with what I call like active seniors and non-elite or non-professional patients. Really anyone who's looking to improve their function and improve their quality of life. I think that's what a lot of us are missing, and especially what I'm seeing in my patients at Spalding is I have to discharge them well before they've really hit that quality of life, right? Our insurance standards now are so tight, and it's basically, okay, you're able to walk now, you're done with physical therapy. And that's where my brain started thinking like, well, what about those patients after that? Like, what about the patient? I just evaluated someone the other day who left Spalding. My colleague referred her to me. She wants to play tennis again. Her insurance company is like, well, that's not that important. Well, to her, she said, I haven't played in 2 years. I don't feel like my balance is good enough to play tennis. And I said, well, why not? Why don't we work on that? And, her eyes lit up, and she said, then let's do it. So that's where my passion is. That's what drove me to start this business. And I just feel like our insurance companies right now are not helping us with what makes life worth living. They're dictating when you're technically done with physical therapy. I do want to give a quick disclaimer. Treatment really should always be individualized. That's something I firmly believe. So what I'm going to talk about today is just, giving you a very brief overview of the common causes of back pain, what a presentation of common types of back pain look like, brief understanding of my evaluation process. I'm not trying to turn you guys into physical therapists. And then start to think about the treatment and prevention process so that you guys can carry that into what you're doing here training with these guys or what you're doing on your own. My goal is not to evaluate, diagnose, treat anyone's back pain today. I will be happy to stay after and talk to anybody who might be interested. I always set up a phone consult with any prospective patient to make sure we'd be a good fit to work together. So I'd be happy to do that at the end. But I will welcome questions along the way. If it feels like it's becoming kind of an individual answer, I might then just hold that to the end and talk to you individually, but feel free to ask your questions and I'll answer them the best I can. Any questions to start? All right, let's get to it. So when Liza and I talked about what we should talk about today, she said a lot of our clients here are either having back pain or have had back pain. So I wanted to start with the two most common types of what I'll call mechanical back pain. And the first one is something called stenosis. Does anyone want to take a stab at what this means from like a medical terminology?
I think it's what's the word? Tightening of the spinal cord.
It can be.
Blocking.
Yeah. Stenosis is a very general medical term that means narrowing.
Mm-hmm.
So you can have stenosis actually in your arteries, right? But when we talk about spinal stenosis, we're talking about a narrowing in either the spinal, where the spinal cord is, right, the center, or in those little holes between our vertebrae where the nerves exit the spinal cord. More often, that's what's causing our problem. The second thing we're going to talk about today is called disc pathology. Pathology is a very general term. It can be used for all different conditions, but disc pathology means a disease of the disc. So you might have heard some of these terms: disc bulge, disc herniation, disc degeneration. That means a loss of disc height, or a fissure, which is a tear of the disc. Those all sound scary. We're going to talk about this. And just to give you guys an idea, the role of our discs. When I say discs, can everyone picture like a spinal column from our neck all the way down to our tailbone? There's each individual vertebrae, and there's a disc in between each one. So picture the disc. It's a jelly donut, right? It's got a thick outer ring, and it's got jelly in the middle. The role of this disc is to help absorb shock. It's to help distribute forces as we move. And really importantly, it keeps a nice space between our vertebrae so that we stay nice and tall. This is why we actually shrink as we get older, because those discs do get a little bit flatter. So, I brought a picture to show you guys. This is our jelly donut. Do you guys see this? Mm-hmm. So, nice and round, right? Over time, it starts to degenerate, which just means it starts to lose its shape. Then, it can actually bulge or prolapse, which means the jelly starts to push against that outer ring, stretching it, making it a little less tight, right? Now that ring can actually break apart and the jelly can escape. That's called a disc extrusion. And then the worst type of disc injury is a sequestration, where the jelly is actually out and seeping down. This is incredibly painful, but people recover really well from these without surgery. All of these. So, actually everything I'm going to talk about are things you can recover from without surgery.
Jamie, are those results of injury alone, or can they be just aging or genetic, or?
Definitely aging. This, I will show you a graph in a minute, is mostly aging. It's just time on Earth and gravity. Yeah. These can happen with one bang, right? Like you lift and boom. I don't think this can happen without things that led up to it, though. I think repetitive bad posture, this I think is how it starts, and then you might have an event like this, but more often it's repetitive stress and loading your discs the wrong way, causing them to get here. I wouldn't say genetic.
Okay.
I would say it's much more like static and dynamic postures that get us there. Yeah. This is, I think, a really helpful picture to understand when I mentioned it maintains height. So now we're looking at the spine from the side, and this is two vertebrae and the disc in the middle. So this is a healthy disc. And this red structure is showing your spinal cord that runs down the vertebrae. And then these are cut off, but these are nerve roots that come off at every level, and that's what helps us move our arms and legs. So just appreciate from this picture that you've got a healthy disc that's big and full, and then over time it starts to degenerate. So it gets a little flatter, and you can see the space here starts to become smaller. That's an example of stenosis, right? It's narrowing because our disc is becoming flatter. It happens with age, but it also happens with bad posture, repetitive stress, things. Kathy sits up. So this can be seen in someone's spine who's in their 20s, much more often in their 70s, but it can happen, right? And then advanced degeneration, the disc is almost completely gone, right? More stenosis, more rubbing of these two bones, right? Arthritic changes start to happen. So this is what someone's spine will look like throughout their life, but you can get here a lot quicker with some of the things we're going to hopefully avoid, right? And Kathy, to your question, this graph was a study of over 3,000 people. And it shows along the bottom here age from 20 to 70. And then on top here, the prevalence of these disc pathologies from 0% to 100. And you can see by the time someone's 70 years old, they have over a 90% prevalence of disc degeneration. And I just showed you those pictures and they looked scary, right? The great news is, if anyone noticed up here, this is asymptomatic people, meaning they don't have pain. So 90% of those 70-year-olds out there have disc degeneration, but that's because, like I said, they've been vertical on this earth for 70 plus years. So it doesn't mean you're going to have pain, but it can be something that can lead to problems if it's not managed throughout our life, really. So I like to try to capture people before they actually have a problem, because then it's a lot harder to treat, but treatable.
Jamie, I have a question.
Yeah.
When they shrink, when the discs shrink or collapse in, does the liquid flow out always, or is it just absorbs, or what happens to it?
Yeah. So when we are asleep at night, right? We are laying flat, and so our discs actually fill back up because gravity is not pressing down on us. And this is why, if anyone's been told you're taller in the morning than you are at night, that's true. Because each one of these discs between your vertebrae get a little flatter throughout the day. You don't notice that unless there's a weakness of that ring, right? Now that flattening, it's pushing outward, right? So it might be bulging, or if there's a tear, now it's actually out and it's up against that nerve, and now you have pain. So this is why a lot of people have less pain lying down than they do standing up. But those of us who don't have pain changing positions, it's because that process is happening, but there's not, a release of that jelly, right? Did that answer your question?
Yes.
Okay.
Yes.
Any other questions?
So is it more unusual to have more pain laying down than stand? I have more pain laying down. That's why I'm asking.
Yeah, so we'll get into that. Typically, disc problems are better lying down because of gravity, but
My life.
but there are lots of reasons for back pain. A disc problem is only one of them, and it could be in combination of things too. Oftentimes, lying down can have more to do with the position of your spine, which we're going to get into. But typically, unloading is what we call it when you lie down. The discs feel better because, right, you're not pushing down on them. Imagine the jelly donut when you do this versus lay it on its side and don't touch it. So a weak disc would probably feel better lying down, but not always. We'll get into that. Any other questions? All right. So I want to go over a couple of definitions because I'm going to use these terms, and I want to make sure we're all on the same page. So flexion is when we bend forward, and extension is when we lean backwards. And pelvic position has a lot to do with what we look like when we stand, right? So most of us have some amount of curve to our spine and some amount of tilt to our pelvis. So for me, my pelvis points down a little bit and my back is curved here. I can tilt my pelvis all the way the other way, and that would reduce that curve of my back. Does everyone follow me? This will make more sense in a bit. But so pelvic positioning can change the position of your lower back. Okay. So let's talk quickly about presentation. Someone with stenosis has more issues with being in extension, right? The spine actually narrows down when they stand up. So they are going to have more pain when they are standing for long periods, walking for long periods, and also when they transition from sitting where they're flexed and feel good as they stand up. Okay, so if that sounds like any of you, that might mean you have stenosis. In contrast, they feel better when they flex forward. So sitting down typically alleviates the pain. And they report what's called the shopping cart sign. So they say it really hurts when I walk, but somehow I feel great in the grocery store. And the reason for that is when their hands are on the cart, they actually are flexed forward a little bit. And that is sometimes just enough to alleviate the pain in their back. I use the analogy of it's like stepping on a garden hose, right? When they're standing up, their spine almost clamps down on those nerves, starts to send pain down one or both legs, and then they do this, and it's like taking your foot off that hose. And it's immediate, right? Anyone who knows someone with stenosis, they have pain walking, they sit or they bend forward, oh, feels better. And pain, like I said, can be down one or both legs. It's pain, it's a deep ache, it's almost like I can't keep going, right? A disc presents almost the opposite. And I brought a picture to help show this. When you flex forward, the spine bends forward, and that jelly, this is natural, it moves backwards. But to your question, if you had a tear back there, now the jelly is pushing into this space. And I'll bring back this picture. Unfortunately, it's the opposite direction, but the spinal cord and all those nerve roots are what live back there. So when you bend forward and the jelly starts escaping, that becomes a problem. And then when you stand back up or even exaggerate and go backwards, the jelly shifts forward away from those sensitive nerves. So typically, bending is worse, extension is better. It also depends on where that tear is, so that's why for you, it might be worse to be in extension. It's not this is what's common, not 100% of the time. So people with disc injuries typically feel worse with flexion, right? So bending, lifting, even anything that increases pressure in the disc, sneezing, coughing, straining, because that's like taking that jelly donut and just squeezing it. So those things tend to make those patients feel worse, makes them feel better when they stand up, maybe even do a couple back bends, or typically lying down, which I call unloading. Typically, it's on one side. Many people call this sciatica. That's an umbrella term, but it is often referred to as that. Can be just localized to the spine. It can go all the way down into the foot. And it can lead to more than just pain. It can be numbness and weakness. Good with all that? Okay. When I start evaluating a patient, I'm essentially asking a lot of those questions. What makes your pain better? What makes your pain worse? That leads me directly into treatment and how to help. The only red flag I basically hit the stop button with is bowel or bladder changes that are recent or progressive and significant weakness in their leg, or if we're talking about the neck, in their arm, because these can be irreversible, and if there's a significant amount of nerve involvement. So we want to address that right away, and almost never PT is the answer. It's probably an injection, maybe surgery, things like that. So those are my only red flags. Otherwise, I'm pretty confident I can help these people get better. So, where do I start? Yeah.
What if it's due to something like scoliosis?
Yeah, so scoliosis can be diagnosed early on, right? Like usually in your teenage or preteen years. I don't typically see those patients until they're adults, right? And I hear that, like, oh, well, I have scoliosis. If you've had scoliosis for a long time, it is likely your body has done a really good job accommodating that, and anything that's more acute is something that we can reverse. If it was something that was not going to be reversed when you were like 12 years old, those patients typically have surgery, right? If the curve is pretty advanced.
The curve's not that bad.
You have scoliosis, yeah. It often is not something, obviously I don't change it, and it's often something that's just a note on my evaluation. But, yeah. So my initial goal is what I call put out the fire. So the fire is the inflammation, that angry part of your spine. And, when patients say, well, what about strengthening? And what about, I don't want to take that NSAID or whatever it is. And I say, well, if your house was on fire, you're going to call the fire department. And you're not going to think, oh, shoot, my house is going to get wet. Right? And you're not going to think, oh, God, like, what am I going to do to rebuild this house, right? I got to replace the couch now and this. No, you call the fire department and you put out the fire, right?
Jamie's husband happens to be a firefighter.
Well, I practiced this for him and he was like, I love that analogy. Shout out to Seth, the firefighter. Yeah, so put out the fire, right? So hopefully that's with PT. I can generally gauge within a visit if it's going to need to be more than that. Typically more than that means an injection, which is just a heavier dose of an anti-inflammatory, a bigger fire hose, right? Not a garden hose. But yeah, put out the fire. So what can we do? Where I always start, if I don't think they need the injection, but PT will help, is focusing on what I call their directional preference, okay? So what is causing your pain? and what can we do to move differently. So I'm going to bring us back to our patient with stenosis. Does anyone remember? Someone with stenosis, they feel better when they flex or extend? Flex. A plus. Good job, guys. All right, so they have pain when they walk, right? So typically when we walk, we take nice long strides, and we typically get a lot of extension as we walk. So I'm going to recommend that they take a little bit of shorter steps and maybe even round their back a little bit. Patients always say, well, that's bad posture. And I remind them about the fire, right? Don't worry about your house getting wet. Round your back, round your shoulders, take smaller steps. If it's a patient that might already use a walker or a rollator, I say use it. Just like the shopping cart, right? If they say they like the shopping cart and they don't have a rollator, which is just a 4-wheel walker, I say get one. Put your modesty aside. We're putting out the fire, right? You might only need to use it for a week or two, but put out the fire. So that can help with walking. Standing, I tell them just to lean on the counter. This would be, you know, maybe up about here if I was washing my dishes. Put your belly and your pelvis against the counter and let your back round. It also helps unload the back, so people with disc problems like that too, but it allows you to free up your hands to do what you need to do. But lean into it. So washing dishes, cooking, brushing your teeth, anything where you're standing for a long period of time, lean against the counter, bend forward. And those transfers, right? Transitioning from sitting, so they're sitting down, back feels great, they're rounded, and then they go to stand up and they typically get pain. So I cue them, exaggerate rounding your back for as long as you can by using your butt to stand up. And then keep your abs tight so when you stand up, you're in that pelvic tilt and you're not here. We're going to practice this in a minute. And then our disc patient, right, they feel better when they're upright. So when they're walking, it's kind of the opposite. Keep your shoulders back. Keep your back upright. Don't slouch as you walk. When you're sitting, keep your back straight as best you can so that, and when you stand up, keep your back straight. Try to avoid bending forward. Getting dressed in the morning is a big one. I mentioned when you lie down at night, your back, your discs get bigger, right? So when you're lying down at night, your discs get nice and full. If there's some injury to the disc, as soon as you go to stand up, that's the time of day there's the most pressure on your disc. So things like getting dressed, cross your leg to put your shoe on, or even put it up on a little bench. Don't bend down to tie it. Even sitting on toilet seats that tend to be lower, make sure you're not slouching. Sit up nice and tall. Even I have patients, I say, wherever you, like if you have to bend down in the morning, say your underwear drawer is down here, well, take your underwear out the night before, or just put the underwear on a different drawer, right? Like in this acute phase, don't bend down, especially in the morning. Those first 3 hours, I think the studies have shown, is when it is the absolute worst to bend. And unfortunately, that's when our day starts, and we gotta do all those ADLs, right? Getting dressed, bathing, things like that. So just work smarter about what can I do to avoid bending, especially in the morning.
Activities of daily living.
Yes, activities of daily living, thank you. For people that have to sit, drive, work, right? I recommend a cushion called the Tush Cush. I brought mine, and if you guys want, we can just pass it around and you can sit on it just so you can feel it. But what I want to point out is it's not just a cushion. It has a slope to it. So it's 3 inches here, 1 inch here. And when you sit on this, it tilts your pelvis forward, creating that extension that someone with a disc problem would have an issue with, right? So this is a regular Tush Cush. They sell ones called the Car Cush that fit better in the car. I just went to their website the other day. These are like $50. I know they have free returns if you buy it and you don't like it. They're an awesome company. I wish I bought stock in them because I've recommended them so much. And what I will say is I personally bought a knockoff when my back was hurting. This was many years ago. And within 2 months, it was flat like a pancake. My mom got one of these 10 years ago, and it's still perfect. So if you think you're going to want something like this, don't get a knockoff. Buy it from them. The $50 will be the only time you have to spend it. Again, they don't pay me to say that. I just think it's an awesome product. So try sitting on it, see what you think. Now again, those with like stenosis would hate this, so if you don't love it, that means it's just not for you, but just feel it. Alright, so actually that was a bad segue because now I want us up and doing something. When we come back to your seat, you can try that. What I want us all to do, and I have space up here and I have space back there, I'm going to have us all, in a minute, learn how to find pelvic neutral. So when I say pelvic neutral, what we're looking for is finding the right position of the pelvis and the spine for optimal function, okay? And pain relief if that's what you're dealing with. So, if anyone's not comfortable with this, that is totally fine. But if you want to try, I'm going to ask you to lie down on your back, anywhere where there's space.
That feels horrible to me.
And you hate lying down, so that makes sense, right? There's probably an
Well, I mean, I don't
extension.
hate lying down. I love going to sleep. But my back doesn't.
The extension, yeah.
One against the wall. I don't know why you're going
That's ankle.
And always be telling me that stuff, and it's not always right.
Alright, so once you're lying down, so everyone's on their back, feet on the ground, knees bent, wherever your knees are comfortable. Place your hands across your lower stomach, and if you can feel, there's bones kind of right above your hips. That's your pelvis. They're kind of pointy. And I can walk around too if anyone needs help finding these things. But what we're going to practice is what's called a pelvic tilt. So what I want you all to just notice is when you're lying here, we all have a little bit of a curve to our back, some more than others. If you were to arch your back and tilt your pelvis towards your feet, that would be called a forward pelvic tilt. Majority of people don't love this position, but if you do, you might have a disc problem. And then you're going to tilt the other way. So try not to use your back muscles, but more like your stomach. Like pull your belly button in and tilt your pelvis the other way. And it should feel like that small of your back kind of flattened into the ground. I like to visualize a set of headlights that I'm moving down towards my feet. That's the forward tilt. And then I tilt it back up towards my eyes. So when you tilt it up towards your eyes, that's a backwards tilt. The majority of people feel better in somewhere in that range. So as you're going through that, start by just going all the way one way and all the way the other way. And then pelvic neutral is where you feel the most comfortable. Where you would say, oh man, if I could live here, this feels pretty good. And I'm not going to say what's right or what's normal. Everyone's a little bit different. Everyone's spines are different.
What if they all feel equally bad?
If they all feel equally, does the starting position feel best? No. Make sure you're not lifting your hips up. And you're not using your back to push into the ground. You're trying to use your stomach muscles. My question was going to be, those doing this, do you feel your lower stomach and your butt muscles working? Or something else?
I feel my lower stomach muscles working.
Okay, that would be
Not
the
really
right one.
butt though. No butt.
Alright, so if you're not quite getting enough of a tilt, try squeezing your butt. I think of this like turning a steering wheel. You might have to use both hands to turn that wheel. So you're using your lower stomach and you're squeezing your butt to get your pelvis to tilt. And again, this is not a one-size-fits-all. There's about 15 of us, so this might not work for everybody. On an individual patient, we would move on to something different. For the sake of today's presentation, this is just to demonstrate how to find pelvic neutral. If you guys are good with that, we can come back up. If anyone has any questions while we're down here, let me know.
That was nice. Yeah, just like that. Ow. She was really amazing. You guys were talking and right.
And we can keep passing around the tush push too.
Can't get that tush tush.
signs are up.
Yeah.
They are.
Yeah. Yeah, it's the opposite of the tush push.
That's actually why driving tends to be really almost worse for people. When sitting is bad, driving is worse because they're in bucket seats,
Yeah.
like most chairs, and
I
most
know.
most people's spines it's too much, right?
Yeah.
So what we were just talking about is the actual seat position can be like the tush push, right? The tush push is tilting you forward, which some people like, some people don't. Some people feel fine in the car because their pelvis likes that almost end range tilt. And as you guys were just practicing that, you could kind of feel it's like, ooh, if I tilt too far, that's not good. I need to be somewhere in the middle. So with seat positioning, we want to look at that. Like, okay, once we find pelvic neutral, if that's the issue, are you sitting in pelvic neutral? Are you sleeping in pelvic neutral? You know, people that sleep on their side, all tucked up in this fetal position, well, your back is in quite a bit of a pelvic tilt. And again, that might not be what your back likes at night. So if you're in that position, I mean, oftentimes people say, oh, I toss and turn all night. Yeah, because your back probably is like, I don't like that position, I don't like that position. So I do a lot of training on like where to put pillows to kind of get you, pillows between the knees or around your belly so you can't go all the way up here. Sleep is tough because you're sleeping. So I do a lot of like, let's get you set up in the right position. Same thing with sitting during the day if you're at a desk. Like, you've got to get into pelvic neutral, whether it's with a tush push or maybe it's a box under your feet to get you into a more pelvic tilt. Maybe you need some lumbar support so you're not slouching here. I do a lot of ergonomic stuff because, yeah, the way that you're sitting, unfortunately, we sit, drive, and sleep 90% of our day, right? It's kind of depressing, but that's the reality. So if you have back pain, oftentimes it's not the stuff you're doing here at Duddy Performance, it's what you're doing when you're not moving. I find that that's the case more often than not. Was there a question?
Yeah. How do you feel about those curved pillows? I read a lot about those. Sleep is hard for me. So
Yeah. I feel that your pillow should fit you correctly the way your shoes should fit you correctly. And a lot of people out there are like, this is the best pillow for everybody. And we all here would probably think of our favorite shoes, and it's because they're comfortable and they fit us. But it might not be the same shoe for everybody. Mm-hmm. So I don't necessarily prescribe, like, you have to go get this pillow. Same with, like, some of those are really dense, and some of them are really soft. It doesn't matter. What matters is when you put your head on that pillow, whether you're on your side or on your back, it fills the space here so that your head is not tilted too far down or pushed too far up. And then also what most pillows lack is that cervical support. So when you lay down on it, if you feel like your head's kind of doing this, you want some support there. I still don't recommend going out and buying the pillow with those little humps because, again, like those Tempur-Pedic pillows, you got me on my soapbox, I'm getting a bit crazy. The Tempur-Pedic pillows, right, it's like we got little hump, big hump.
Right.
That's like size 6 shoe and size 8 shoe. And that's why some people are like, I love my pillow, how can you not like it, right? Well, if you're a size 7, it doesn't really fit, right? So what I recommend is take the pillow that you have, that you like, right? It's the right density, it holds your head in the right neutral position, and then roll up towels. I typically recommend hand towels. So you stack maybe 3 or 4 on top of each other, roll them up like a hot dog, put them into the pillowcase so it stays. And you need a tight pillowcase so it doesn't move on you. And then lie down on it and see, okay, does that fill that space? You should not feel a gap in your neck when your head's on your pillow. And this is good if you're on your back too, right? We have a curve there too. But yeah, you want to make sure the pillow fills the spaces when most of the time they don't. And I know we're talking about back pain, but I think our spine is one column. So I'm glad you brought that up because I think the neck can be where it starts, right? If your neck is doing something funky, it can kind of trickle down. Did that answer your question?
Thank you.
Okay.
Yes.
Yeah, so good alignment, good fit, doesn't matter what brand. Everyone get a chance
I
on
think
it?
everyone got the tush push.
Cool.
What about if it's sitting without back support? Like some of our friends in the back. What does that mean? Sitting without back support causes a lot of pain.
Yeah, it means your spine needs support. I don't think it's ironic that, remember, I don't even know, 5 years ago maybe, there was that like push for sitting on those yoga balls throughout the workday. Mm-hmm. There's a reason no one's doing that, right? Like, that's great if you're trying to work on your core, maybe for like I don't know, a lot of people sit and do like rows on that if we're trying to work on like core strength, right? Not 8 hours. Like no one works out 8 hours. So no, when you're sitting, well, first of all, don't sit for really more than an hour. Our bodies are meant to move. There's a saying now that sitting is the new smoking. It's killing us.
Oh my god, you just said that on Friday. She just said that on Friday. I'm like, I just heard that.
It's true. It's true. And you guys come here, or those of you that do, to move, right? We feel better when we move. I can get on a soapbox there too. But you need to support your spine. You need to have your pelvis in neutral, and you need to have back support. You need to have arm rests. Everything needs to be supported if you're sitting at a desk all day. Yeah.
Sort of similar, is there an office chair, either brand setup that you think is better than others?
Yeah, it's a similar answer to the pillow. It needs to support you. It needs to fit you. I think, as you get more expensive, like the Herman Miller chairs, my husband got one because we found it on Marketplace for like $500, and I said, I'm a PT and I can't justify $1,500 for a chair, but it is nice. And the reason it's nice is because it literally can be adjusted every way possible, right? The armrest, tilt, forward, everything, height. The back rest, the seat tilt, which most seats don't. That's why we do the tush push. So if I had to give a brand, now that he bought it, I do like that it has a lot of versatility. But if you can find a cheaper chair that can have versatility, then I think that's a good chair too. It was crazy the number of people we saw at the beginning of the pandemic with ergonomic related neck and back issues, because they were like, sweet, I get to sit on my couch and work. And that was horrible. And unfortunately, a lot of companies didn't support, okay, you're going to work from home now, let me get you all these ergonomic things. So people were working at their dining room chair or whatever. So a chair that is supportive, upper back, lower back, hips, feet on the ground, armrests. I think you could probably even just Google like proper ergonomics, and that's kind of what I'm going at, but a chair that can align you there. So the reason we're talking about posture, and the reason I start with that, besides like finding that directional preference and alleviating pain, improving posture and alignment can help reduce back pain. It can improve respiratory function. It can improve symptoms of urinary incontinence, like those who have had children, right? A lot of pressure on the pelvic floor. We're including that. And it promotes optimal body mechanics when you're moving throughout your day and when you're lifting. So, for treatment, I generally start, after we do that, is really looking at the core, right? I call our core muscles our internal back brace, or like a core set, right? It's what holds us together. And I describe the core like a soda can. And I was able to find this picture, which I think kind of looks like a soda can. This is looking at the body from the side, but we can use our imagination, right, and kind of picture a can. Our muscles we have a top, our diaphragm, bottom, pelvic floor, our back muscles, our stomach muscles. And what this doesn't show, and I wrote in, our hip muscles and our glute muscles, right, our hip flexors and our glutes, and deep hip muscles all support our core. If any of these muscles are weak and or tight, it's going to create imbalance, right? When I think of the core, I also think of how we sometimes call it the trunk. You guys heard that? Called the trunk. So I picture a tree, right? The trunk of a tree is the biggest. It's got the roots into the ground, and it has limbs, right? Our arms and legs, right? It has limbs off of it. The limbs are not the biggest and strongest part of the tree. It's the trunk, right? But many of us fail to think about our core muscles as the most important part of our body. And if we're doing a lot of, arm work or leg work, but our core is not weak, we are a unstable tree, right? So just to demonstrate this, Liza, can I have you come up real quick? You have a shoulder problem? No? Okay, you can stay right here. All right, so I want you to hold your left.
Do you want me to have a shoulder problem?
No, okay, different presentation. I just don't want to hurt you. I want you to try to hold your arm there. Just use your arm muscles. Try to relax the rest of your body. So don't tighten your abs. Don't tighten your glutes. And
The relax that you did was like.
I was like, I can do it. All right, so try to only use your arm muscles. Okay, don't let me push your arm down. All right, now obviously Liza is much stronger than me, right? So using just her shoulder, it's a little bit weak.
Yeah.
All right, now hold your arm up, tighten your abs, tighten your glutes, and I want you to think of your feet like roots. Root yourself to the ground. And this is real, guys.
This is real.
Much harder for me to push her. You're a strong trainer, ladies and gentlemen. So without those muscles, right? Without her core, without her glutes, just using her shoulder. Same shoulder muscles. Her shoulder was much weaker. And I sell this too. I do that in my evals to young, buff guys that are golfers, baseball pitchers, and they're like, why am I working on my core, right? I've got it. I'm trying to swing the golf club. I'm trying to throw. And I say, all right, well, and I do that on their good shoulder, right? I don't test it on the bad one. And I say, your arm just got stronger by us strengthening your core. And then all of a sudden they're on board for core strengthening. So make sure if you're training here or elsewhere, you're not neglecting the core muscles. So part of a formal evaluation that I do is assessing all of these muscles. And this is not even a comprehensive list. There's a lot more. But there's a lot that goes into the core and making sure it's strong. So an individualized assessment and an individualized treatment program to make sure those muscles are all working appropriately is really important. So in summary, guys, I would say think about pelvic neutral. What does that mean? What does that feel like for you? If you do feel like you have this strong directional preference, think about some of those things I mentioned. How can you stay out of that direction, especially while things are inflamed? And making sure your core muscles are doing what they're supposed to. Are there any questions? Yeah.
I'm a long distance runner, and I get like dull low back pain at the end of a very long run. And I work out here, so I'm doing lots of core shit. So it's not that, please. I don't know if there's anything else like to do. And I've had a running evaluation. I go to Spalding and Framingham. Like,
Okay.
I do all the things. Can't get rid of. Like, I'm 30 miles in, and my low back is just like screaming. And I know it's hyper specific, but
Yeah, I think what I would want to know is like what you've tried already. You know, what things haven't worked, because I might, without knowing any of that, I would probably start to suggest things you've already tried. So if we talk at the end, that might be more helpful. Any other questions for the group? Yeah.
I have that issue you mentioned before where like I'm a side sleeper, I put a pillow between my legs. I've tried to get a pillow that fits my, neck. It's like squishy or something, like has beads in it. But I still from time to time struggle with like low back pain throughout the night. So like what would be the first thing you would suggest in terms of like I don't use any pillows in front of me or behind me or anything like that. Like, is there something you could suggest that I could try? Like,
You said you've tried pillows between the knees?
no, so I always sleep with a pillow between the knees and one under my head, but nothing else. But it still doesn't work.
When you were lying down, did you feel like there was one position that was better?
Well,
Do you like being more extension or flexion?
I was lying on my back here, but I sleep on my side.
Yeah.
So I typically like to pull my knees up a little bit.
Yeah. So what I was thinking is if you were on your back just doing that exercise and you do like a full pelvic tilt and that feels like it's too much pulling back there, but you sleep in basically that position, it might be helpful to, like I said, put like a pillow where your belly would be so that your knees just don't have that place to go. It might be that you're not sleeping in your neutral. Again, sleeping is really tough. I also think that our problem sleeping can be just what we're doing throughout the day. So if I give some initial sleeping ideas and patients say that's not really helping, then I want to focus on what's happening during the day. Because it's almost like if you're rubbing two sticks together and creating friction all day, nighttime is typically when those symptoms are going to arise because you're now lying down. And I mentioned that's good for disc problems, but everything else, like arthritic things, that's when things stiffen up and we tend to have more symptoms at night. So I would want to focus more on what's happening during the day that's maybe causing stiffness at night if it's not something as simple as like just your position. So if you can figure out pelvic neutral, maybe see if like maybe that's not good to be sleeping up like this and see if you can kind of box yourself in so you don't get there. But if that's not it, I would say it's probably more than just sleep. Yeah.
And so you're saying it's very possible that when you go to sleep, pulling those knees up could feel very comfortable, but not be your optimal position.
Very likely.
So it's like you're lying to yourself because you're like, oh, but this is how I sleep. It feels so good. But actually, it's not good for you. So that little bit of
Gaslighting
exploration.
It might not be good.
Yeah.
If someone says, I sleep like that, but I'm tossing and turning all night, if you can sleep that way all night. For some people, it's fine, but that's why it's so individual. And I think finding that pelvic neutral, and again, that's not always the solution for everybody either. But for me to come up with like a topic that might be a good starting point, yeah, that's where I would start. Anything else?
Are there other things that people can do, like foam rolling or mobility? Like, is there any other overarching topics that, because they're really good about the core too. Check plus to all the Debbie performance athletes.
Yeah, I think a part of my evaluation definitely is looking at mobility. Oftentimes, and this is where we could really get not off topic, but down a whole different trail. But like hip mobility can often cause stiffness in the lower back, right? So when we flex, we actually have to go posterior with our hips. So if my hips don't move and I just try to flex, so yeah, mobility is huge. Again, it's like so specific to like what your issue is, but I mean, I think for anyone to foam roll is always a good starting point. You find some trigger points. I think all of us are stiff in our thoracic spine, so doing extensions, but protecting your lower back, right? Just extend your upper back. I typically incorporate foam rolling with most patients, although I see a lot of older people too that can't get on the ground, so foam rolling is sometimes, we have to find different ways. But yeah, oftentimes like our hip flexors can be overactive because they're overcompensating for other muscles, and that's pulling us down into a forward pelvic tilt, right? So for me, like I don't like extension. I feel better here, but my hip flexors are really tight, so I tend to hang here. So for me, like I do a lot of hip flexor stretching, a lot of like QL stretching. I have 2 kids and they've ruined my body. So I'm standing here like, they won't see this video, right?
Your husband's watching, so.
Yeah, I mean, my back hurts all the time too, right? So I can relate to, but if I do my foam rolling and mobility things first, and then I follow it up with a lot of core stability, I do find that really helps. So yeah, I don't think it's just stabilize, right? Like, but you can't just mobilize either. And you guys know that, but yeah.
But thanks for saying it.
Foam rolling is yeah.
So a lot of my pain comes from just household chores, like the dishwasher, folding laundry. Do you have any recommendations on like what I can do to kind of like prep my body for that, or just get through the day better?
Big picture, longer term, probably need some core stability, right? But body mechanics are huge. Again, it could be a whole different topic, but lifting and things like that. Maintaining that neutral spine, right? So when you're bending, whether it's a squat or I call these golfers lifts, maintaining good position of your back and not doing this. I know like my son has the Legos or little toys, right? Little Matchbox cars, things that you feel like you're repetitively picking up. I get on my hands and knees and I crawl because I can keep my back neutral. Loading the dishwasher, loading the top loading laundry machines. I put my hand on my counter, and that's where I do my golfer's lift like this, so I can keep my back straight. And then my rule of thumb that I tell patients is if you can pick it up with one hand, you can do it on one foot, right? So if it's a plate out of the dishwasher, and I just do all my plates, right? All 8. And then now I need 2 hands, so I'm going to have 2 feet. So I'm going to turn my body, and I'm going to do a little squat. I'm going to make sure I brace, and then I'm going to put them up. And some days I don't even do all 8. I do 4 and 4, right? Like it's knowing your body, but I think preparing your body, how you train it is big. But when you go home now and have to do the laundry, I would say think about just even tightening your core. Yeah. Like Liza showed how strong her arm was. You might not have good endurance, but you can tighten your abs and tighten your butt, right? To pick something up. Yeah. And like getting groceries out of the trunk. Anytime where we kind of do this, get your feet here and like pull it closer to you and then bend down and pick it up. I think avoiding things that are heavy on one side is a good idea. Like, so you're not doing this. Heavy purses, those are hard. So if you got to carry 2 bags of groceries, I think it's better to have them on both sides. But yeah, I think thinking like, okay, what can I do to protect my back and not just say, oh, this is going to hurt. Vacuuming is another big one, right? For whatever reason, we all tend to like stand in place and then like do this. This sounds simple, but like walk with it. And then when you're getting like underneath the table, kind of like a split, and then use your legs. Keep your back straight, more like that. Did I not cover anything that you come to?
No, that was good. No suitcase carries.
Yeah, it was helpful.
There you
Each
go.
chair is different. It's different.
It is-
It's protected environment.
It is different. No, it really is different. And there's been studies on this. Like you train, if you train, how do I want to say this? Like if you're training your body, that's different than like I'm going through my day and I just want to like not have pain. Because if you had pain doing suitcase carries, your coaches would not have you do suitcase carries, right? It means you don't have enough stability to do that.
Yeah.
But I think you want to train in all the ways so that you don't have limitations. But when you're in pain, it's kind of, I think, in the framework of like, well, you have some limitations right now. How do we work within those? Yeah.
Does it make more sense, like at work I have a bag I carry over my shoulder with my laptop and various research books and stuff. Should I really switch to a backpack? Is that okay?
Yeah. I recommend either a backpack or a crossbody bag. Helps distribute forces better. I had someone the other day, I recommended like, they're a professor, so they're always carrying a lot of stuff, and I was like, what about like one of those rolling?
Oh my god.
And they rolled, I was like, I know. Well, I forget why. She said she couldn't do a backpack, wouldn't do the crossbody, and I was like, we were just having a disagreement. I was
There's a lot of
like,
options.
I was like, well, don't carry your, she had like her briefcase and her lunch and her, she's probably not going to pull her little suitcase thing, but yeah.
So when you were talking about how when you first get up in the morning, it's sort of the time to be, careful more because of waking up. So in terms of what time to work out, because I have found if I get up, because I like to get it out of the way in the morning, but although it's hard to get up early. I like to get it out of the way, right? Whatever. And so, but when I run in the morning, for example, I don't run as well. I don't feel like I've got the mobility. I can tell. And if I run later in the day when I've warmed up a little by, being awake. So is there a rule there? Is it like just listen to your body, obviously, or what are your thoughts?
The studies show that it's like the first 3 to 4 hours of the day that your discs are the most like plump, right? And it just takes being up and letting gravity kind of settle them. So I don't know if you can really like work around that. I would say if you're like, I'm gonna work out in the morning, I would just make sure, A, that you've got a lot of support around those discs so that they're not vulnerable. But also that you're doing enough mobility ahead of time, like before you go out to run. So I would even do some pelvic tilts, like get and do some. I love like the open book stretch on your side, just getting some like thoracic rotation, hip stretching, like just get everything moving so that all that load is not in your spine, like it can be distributed throughout. But I don't know if that initial fact is something we can like. Work around.
Yeah.
Or you get up in the middle of the night and do like 20 jumping jacks and then like and then like you squish some out in the middle of the night.
I was gonna do that anyway, no.
Yeah, that's a good question. I don't know that there's like a really easy workaround.
Yeah.
Because that's just kind of how our bodies are. Yeah.
I just have to tell that professor or the person. I have this woman I work with who's like in her 40s. She's so cool and so fashionable, and she has one of those wheelie things that is a cool, fashionable wheelie thing.
I didn't think it sounded terrible.
No.
When I said, as I was saying it, and I could tell from her face, I was like, this is not going
Then
to
she's
go.
no, this woman is so cool with her wheelie thing.
Cool. I mean, not
I'm
having...
thinking of getting a
I'm
wheelie
so
thing.
smart and I have so many books. Like,
Yeah.
She's so cool.
I've said a lot, like,
I think
not
that's going
having
to be a
pain.
trend. I think that's going to be a trend.
Yeah. I think pain is a big motivator, right? I mean, I guess almost every patient I see has pain. So I have that to my advantage. So I can say, well, why don't we get you out of pain? And the rollator and things like that, the cane, that's a tough sell for a lot of patients. And that's why I say, we're just putting out the fire. Like, I'm not saying you need to use a cane the rest of your life. I'm not saying, it's like we need to just get you out of pain. Yeah.
What about ice versus heat? Like
Good question.
when your back is at you after a couple weeks, trying to deal with it, and you're doing the ibuprofen,
Yeah.
you are taking it, and you're doing the stretches and stuff, but at night, do you choose what feels better, or is there what you recommend?
If it's at several weeks in, then yes, it's what feels better. The general rule is ice is better for like inflammation, right? And when things are sore, because ice can be analgesic, right? It numbs the area. So if something hurts and you numb it, that can help. But if you're looking to relax muscles that are tight and maybe spasming, heat's generally better. But it's not like a rule of thumb either, because I have patients that they're like, oh my god, if you told me to put ice on, it would like send me into a complete spasm. I hate ice. I hate being cold. I'm like, okay, then we're just, even if that's like for their knee, right, or their ankle, I'm like, okay, then we're just not going to do it. So generally, like if you sprained your ankle, actually new research is for the first 48 hours you do nothing, and then you put ice on it to reduce the inflammation.
Rice is out.
It's very interesting, like if we get into the physiology, when you injure yourself, your body has a natural process to know that something was injured. And the first thing is your body sends, I forget the term from 12 years ago, but it sends some chemical, right, to that sprained ankle to tell your body, hey, there's an injury here, right? Let's swell it up a little bit, give it a little bit of protection, right? It's like an ankle brace. And then your body's like, okay, who do we gotta send? What do we gotta do? So what they found is when you ice or do like NSAIDs right away, you're just delaying your body from knowing that there was an injury. So 48 hours, and then
I mean, you know, you're on the ground.
then you do with your rice. Brain, everyone's got to be involved. So after 48 hours, then you kind of go with the rice, right? Rest, ice, compression, elevation. But ankle sprain. But bats, yeah. I mean, honestly, a lot of these structures are so deep that nothing's really touching the injury, right? If it's arthritis in the spine or a disc that's, you know, herniated, it's just to help the muscles around it. So it's whatever feels better. Yeah. Anything else? Well, as I said, I'm happy to stick around and answer any individual questions. I brought some swag for you guys if anyone wants a bag or a towel. I have mints as well. If anyone does want to get in touch, you can put your name down, give me some contact information, and we'll set up a time to talk.
Here's your push back. I wanted to give it an extended try.
Did you like it?
I did, yeah. Plus, like this.